Hey, I'm Dr. Al Simeone with the Disc Chiropractic, and I want to take a moment to answer a handful of questions related to tendonitis. First question that I often get is, what is tendonitis of the elbow? Well, tendonitis of the elbow is commonly referred to as golfer's elbow or tennis elbow, depending on what part of the elbow actually has the tendonitis. And it typically occurs from these sports due to a repetitive motion injury. Now, that's actually another question that I get is, how does tendonitis occur? Typically, tendonitis does occur from a repetitive motion injury or an increase in stress that's typically related to athletics when the joints, the tendons, the muscles have not been ramped up properly and kind of just jumping into the deep end and putting too much stress, too much load too quickly. Another way that tendonitis can also occur is from poor posture over time. This is very common from things like sitting at a workstation for hours and hours a day, years on years. Another question that I get is, how long can tendonitis last? Well, that all depends on the severity of the condition. So a mild tendonitis might last for a couple of weeks, a moderate maybe for a couple of months, and if left untreated, a chronic tendonitis can last much longer than that. And the other question that I get is, how do you treat tendonitis? Well, in the office, it all depends on what area of the body the tendonitis is occurring at. But one of the best treatments for tendonitis is called shockwave therapy, which we're really proud to offer in our office. Basically, it's using acoustic sound waves to go in and melt away any scar tissue, any damaged tissue, stimulate blood flow to the area that has been damaged, as well as stimulate stem cell production to that area, basically to restart the healing process.